Hello friends, welcome to Baby Tales.
If you have recently decided to bottle feed your newborn, you are probably full of questions about formula preparation, sanitizing utensils, feeding positions, and burping techniques. If the water in your home is chlorinated, clean the utensils in your dishwasher, or wash them in hot tap water with dishwashing detergent, and then rinse them in hot tap water. If you have well water or non-chlorinated water, either place the utensils in boiling water for 5 to 10 minutes, or use a process called terminal heating. In terminal heating you clean, but do not sterilize, the bottles in advance. You then fill them with the prepared formula and cap them loosely. Next, the filled bottles are placed in a pan with water reaching about halfway up the bottles, and the water is brought to a gentle boil for about 25 minutes. Be sure to follow the manufacturer's directions exactly, for the formula type you choose. Too much water and your baby won't get the calories and nutrients she needs. Too little water and the high concentration of formula could cause diarrhea or dehydration. Bring the water you plan to use in the formula to a boil for approximately 1 minute. Then add it to the formula powder. If you are preparing this in advance, be sure to store it in the refrigerator. If the formula is left out of the refrigerator for longer than 1 hour, or if you don't use refrigerated formula within 24 hours, throw it out. Refrigerated formula doesn't necessarily have to be warmed up for your baby, but most infants prefer it at least at room temperature. The easiest way to warm refrigerated or frozen milk is to place the container in a pan of water on the stove at low heat and rotate it frequently. Microwave ovens should not be used. For heating bottles, this can overheat the milk in the center of the container. Even if the bottle feels comfortably warm to your touch, the superheated milk in the center can scald your baby's mouth. Also, the bottle itself can explode if left in the microwave too long. If you warm a bottle or use it immediately after terminal heating, test it in advance to make sure it's not too hot for your baby. The easiest way to test the temperature is to shake a few drops on the inside of your wrist. Cradle her in a semi-upright position and support her head. Don't feed her lying down. Formula can flow into the middle ear, causing an infection. To prevent your baby from swallowing air as she sucks, tilt the bottle so that the formula fills the neck of the bottle and covers the nipple. The pediatrician will probably ask you how much your baby has eaten, so be prepared to answer the question. Your newborn will probably take between 2 and 4 ounces per feeding during his first few weeks. During the first few days, he may take less than an ounce at feedings, and will probably be hungry every 2 to 4 hours. It's best to feed your baby on demand. Don't encourage your baby to finish the bottle if he is not interested. And if he is still sucking enthusiastically when the bottle is empty, offer him more. Babies get fussy and cranky when they swallow air during feedings. This happens more often with bottle infants, though breastfeed infants can also swallow air. To prevent a tummy full of air, burp your baby frequently after every 2 or 3 ounces of formula. If your baby doesn't burp after a couple of minutes of trying, resume feeding. Here are the 3 best positions. Over the shoulder, drape your baby over your shoulder and firmly pat or rub her back. On the lap, sit your baby upright, lean her weight forward against the heel of your hand, and firmly pat or rub her back. Lying down, place baby's stomach down on your lap and firmly rub or pat her back.
To stay tuned with us, subscribe Baby Tales and press the bell icon.